We will take a look at patient consent today. This self-study article takes about an hour to read and concludes with a 10-question quiz. And the best part, this course is approved by the ASCLS PACE program, which is needed every other year to renew a California state CPT license. We first start out with a course description, and we talk about our learning objectives, which are identify the different types of consent, relay the consequences if not properly obtaining consent, demonstrate effective communication, which is necessary to obtain consent, and navigate special circumstances, such as consent for minors and those with impaired mental capacity. We talk about what patient consent is and the types of consent in healthcare. We do a scenario on consent in emergency situations. Then we talk about post-crisis consent and parental consent. We talk about consent for HIV testing and do a scenario on that. We talk about the key elements of valid consent and consequences of not obtaining consent, such as legal consequences, ethical violations, institutional consequences, and professional consequences. We then dive into effective communication and challenging situations, and the use of interpreters. We talk about the federal requirements for interpreters, what qualifies as an acceptable interpreter, and documentation requirements. And we also talk about some common mistakes to avoid when obtaining consent. We are uploading new content every month and new self-study articles. So if this lesson interests you, and if you need to get your continuing education courses done, and you want an ASCLS PACE approved self-study article, take a look at flubce.com.